This is Psychology Radio, where we talk about items that might be on the test so you can get an A. This is Chapter 15, or Psychological Disorders. I'm Tabula Rasa, and I'm going to take you through this. Psychological disorder is persistent and uncontrollable. It causes dysfunction and impairment, and it often not noticeable behaviors, but relying on the person's self-report of their inner state. So you can't always see it from someone else, but they can tell you that it's going on. First vocabulary is comorbidity. That is the presence of two or more disorders in the same person at the same time. Anxiety and depression are most common comorbid disorders. With anxiety disorders, they experience fear, dread, nervousness, and racing thoughts. Different types of anxiety are generalized anxiety disorder, phobic disorders, panic disorder, obsessive-compulsive disorder, and post-traumatic stress disorder. Let's look at the generalized anxiety disorder. Their worries are not focused on any one particular threat and are often exaggerated and irrational. They're accompanied by restlessness, fatigue, concentration problems, sleep disturbances, and physical symptoms, like fear of losing control or of impending doom or threat. They're more common in women, and sometimes anxiety comes after the stressful event. They can be positive or negative. Both of those events can trigger anxiety. How do you treat those? With mindfulness, and they try to get you out of that fight or flight mode. The next one was phobic disorders. That's a persistent and excessive fear and avoidance of specific objects, activities, or situations. It interferes with an individual's ability to function. Often, they recognize the fear as irrational. The fear could be related to animals, environments, situations, or illness. It can be learned by observing others or yourself. The next one is social phobia. When you're worried about interactions, you worry that others are judging you. After interactions, you might replay the conversation over and over again. And how you treat that phobia? Exposure therapy for social phobia, like an airplane simulator possibly, or learning about spiders or being exposed to spiders gradually, maybe being in the same room with one and then working up all the way to being very close to one and possibly even touching one. Little by little, exposure therapy. Panic disorder, that's the next area, is an intense fear and physical symptoms often come out of nowhere. So an increased heart rate, difficulty breathing, sweating, racing thoughts, fear of death, or sometimes bad happenings, fear of death or something bad happening, and they feel the need to escape the situation. They often worry that they will have another attack. And agoraphobia, that's a fun word, agoraphobia is the fear of going out into public. Some people can have a panic disorder just by leaving their house. People generally try to escape the situation or leave the room, right? We try to get them to breathe. This is how to help them. We try to get them to breathe slower and deeply. Let's take some deep breaths together. The worst thing that you could possibly tell somebody that's having a panic disorder is to calm down, right? That's not going to help anything, so don't use it. Don't say it. To get diagnosed for a panic disorder, you would worry so much that another attack will happen, it disturbs your day-to-day function, and you'd avoid the place, situation where it happened originally. Just completely, I'm not going there, I'm not ever going to do that. Women have higher rates of panic disorder than do men. Obsessive-compulsive disorder, commonly called OCD, that's where you have repetitive and intrusive thoughts or obsessions and ritualistic behaviors and compulsions done to help ward off the thoughts. You have a fear that something bad will happen if you do not do the ritual, like checking the back burner or the stove or locks, washing your hands, counting items, arranging items multiple times a day, so often that you're constantly going back. You get in your car, you drive to work, you think, did I really turn off the stove? You actually drive back home and check again to see that you did, in fact, turn off the stove. This is interfering with your day, and that could be diagnosed as OCD, or obsessive-compulsive disorder. PTSD, post-traumatic stress disorder, happens after a terrifying and uncontrollable event, where chronic psychological arousal, recurrent unwanted thoughts or images of the trauma, and avoidance of things that call that traumatic event to mind, like a war or child and adult abuse, violation of body or personal space, car crashes, Death, where you witness an accident maybe, or a suicide, a shooting at a school, etc. Reading the news, stories, TV shows sometimes, maybe jobs, especially violent ones like police officers. It can be a complex trauma if there are multiple events on the job, like a hostile work environment. Many of us will be upset and have nightmares and flashbacks and no sleep, can't stop thinking about it. The symptoms generally do not reduce after time. So the heart pounds, they have difficulty breathing, full-on anxiety. Other things can trigger traumatic events like smell, seeing someone that looks like your perpetrator, and the like. So it's a pretty awful thing to have happen. Then mood disorders. This is kind of fun. Mood disturbances are a predominant symptom, right? There are two types, depressive disorder and bipolar disorder. The depressive disorder has a couple of different areas. The first one says major depression, where you're severely depressed in a mood that lasts 2 weeks or more and is accompanied by feelings of worthlessness and hopelessness, lack of pleasure, a lethargy, excess sleep, and appetite disturbances, and they may have suicidal ideations. Persistent depression disorder, which is formally dysthymia, says the same physical and cognitive symptoms as the major depression, but are less severe and last 2 years or longer. So persistent depression lasts much longer, but isn't quite as intense the whole time. Major depression, 2 weeks or more, pretty intense altogether. Then they have seasonal depressive episodes in a seasonal pattern. That also goes along with, I think, SAD, with the seasonal depressive episodes, and that just happens with a particular season. Like during winter, the sun goes away, whatever season it is, then you just get really depressed. We also talked about symptoms of suicide. You can notice that in a depressed person that suddenly changes, or drastic improved mood, where someone might also be giving possessions away, or someone has a plan that they want to execute. We learn men use more violent means, so they are generally more successful. Like a shot to the head or jumping off of a bridge is generally more successful than women who might take pills or less lethal means that don't always succeed. So an overdose doesn't always work as well as a bullet. We talked about bipolar disorder, which is an unstable emotional condition characterized by cycles of abnormal, persistent high mood, the mania, and low mood, the depression symptoms. In mania, someone may not sleep for days at a time, with risky behaviors of sex, gambling, excessive shopping, unable to sit still, super high talkativeness, grandiosity, believing that they have special powers, and bizarre thoughts and ideas. The highest rate of inheritability of all mental health disorders. So that's kind of scary. That's bipolar. So you got the ups and the lows. With dissociative disorders, that's a significant disruption in memory, awareness, or personality that can last minutes or years. That's dissociative disorder. Significant disruption in memory, awareness, or personality that can last minutes or years. There are three types: the dissociative identity disorder, or multiple personality, dissociative FWAG, and dissociative amnesia. With the dissociative identity disorder, the previously called multiple personality disorder, there's a presence of two or more identities at different times that take control of the individual's behavior. The individual is often unaware of alternative personalities, and they may lose track of time. It's often related to history of child abuse and trauma. Dissociative FWAG and amnesia, I hope I'm saying that right, was where there's a sudden loss of memory for one's personal history, accompanied by an abrupt departure from home and assuming a new identity. We talked in class about a woman that thought she was a mermaid, and that was, she had dissociative FWAG. Dissociative amnesia is a sudden loss of memory for significant personal information, but they retain their identity, right? But they've just lost a whole bunch of information. They can't remember stuff. Both of those two can last from a few hours to a few years, and often they recover abruptly and regain memories and their identities. The next section was schizophrenia. There's a profound disruption of basic psychological processes, a distorted perception of reality, altered or blunted emotions, and disturbances in thought, motivation, and behavior. The symptoms, and you need at least 2 to be qualified, I guess, to have schizophrenia or be diagnosed. Delusions, hallucinations, disorganized speech, disorganized behavior, and negative symptoms. It's more common in males than females. There's a strong genetic link, and about 1% of the population suffers with this. Here's some of the symptoms. Delusion. That's a false belief system, often bizarre or grandiose, that is maintained despite its irrationality. They believe they have special powers or others are conspiring against them to harm them. With hallucination, they have a false perceptual experience that has a compelling sense of being real despite the absence of external stimulation. Hearing, seeing, smelling, experiencing tactile sensations despite no sensory stimuli, like the feeling of bugs crawling all over your skin, but there's no bugs. That could be a hallucination. Disorganized speech is another one. Severe disruption of verbal communication, in which ideas shift rapidly and incoherently from one thought to another unrelated topic. Difficulty organizing their thoughts and focusing attention. That's disorganized speech. Disorganized behavior is inappropriate for the situation or ineffective in attaining the goals, often motor disturbances like tics. Inappropriate sex behaviors in public, disheveled appearance, shouting and swearing, and strange physical movements. That could all be disorganized behavior. The last one, negative symptoms, could be emotional and social withdrawal, apathy, poverty of speech, insufficient normal behavior, and motivation and behavior. That could be the symptoms of schizophrenia. Now we move on to personality disorders. They're deeply ingrained, inflexible patterns of thinking, feeling, or relating to others, or controlling impulses that cause distress and impaired functioning, like unaware of impact of their behavior on others. The 3 clusters of disorders are, the first one is odd and eccentric, the second one is dramatic and erratic, and the third one is anxious and inhibited. The second one, dramatic and erratic, would be where narcissistic would fit in. Another section, substance use disorders. This can happen if it interferes with work, school, home, or relationships, if there's repeated legal problems, if they are driving after using, they have difficulty controlling their usage, they've developed a tolerance and or withdrawal, and have cravings for the drug or alcohol, and then more severe interference if work, school, home, relationships, and legal problems, if they continue to have issues with those things, then that could qualify somebody for a substance use disorder diagnosis. We can go to childhood disorders now. That's autism. First one, the autism spectrum disorder, where a person shows persistent communication deficits as well as restricted and repetitive patterns of behavior, interests, or activities. They have autism on the lower functioning, where there's really more of a nonverbal. And then on the higher side, higher functioning used to be called Asperger's, where they're higher functioning, but they still have all those problems. They say 1 in 68 kids has autisms. They generally like to have a particular taste or a texture. They're not socially aware. They have a lot of repetitive patterns, kind of like in the movie Rain Man. He had autism. Attention deficit hyperactivity disorder, ADHD, is where there are severe problems with inattention and or hyperactivity. A conduct disorder is an aggressive behavior towards people or animals, a destruction of property, deceitfulness, or serious rule violation. And I think the last section is eating disorders. The first one's anorexia. That disorder is characterized by an intense fear of being fat. As a result, they severely restrict their food intake. They tend to have a distorted body image and are underweight, but view themselves as needing to lose weight. They're often high-achieving and perfectionistic. The second one is bulimia, and that disorder is characterized by binge eating followed by purging or throwing up. They are often a normal weight, but they choose to do that to keep themselves, I guess, at that weight. Both are dangerous. Anyway, that's the end of chapter 15. I hope you guys get an A on the test, and have a good day.